Um, this could be dangerous. So, hi, I'm Brian Betts. I'm here with Laj, Megan, and Kristen. We are part of the Indiana State Doctorate in Athletic Training Program in the 2018 cohort. We're going to be talking a little bit about value models today. So I'm going to just start off by asking all of you guys, what's the importance of a value model?
I feel like you're really able to like not just like quantify what you're doing, like you're able to prove to other people what you're doing on a day to day and then in a number and a figure form. But I feel like you're able to show them like, yeah, I can track my data, I can track my outcomes just like the like surgical chief can. It doesn't take a whole staff of people to do this. Like I can do it on my own. Um, if that makes any sense. Like it doesn't have to be this huge ordeal. It can be something that you do on a day to day and then ends up being this bigger project that proves kind of your worth at the end of it.
Yeah, I agree with Kristen. I think you know, athletic trainers all the time, we feel like we don't get enough you know, that we're not valued and we don't get enough worth for what we're doing. And I think that's why the value model is so important with athletic training, because if we don't start to do something and start to show our worth, then it's just going to continue to treat us like we can work 50 hours for $11 an hour, and that's not okay. So I think the value model is like what is important in athletic training to get us back on track and to prove like our value and worth to other people outside of the setting.
I definitely agree with what all they said, and that's what we like we're talking about in the synchronous session too. Like, what are we valued at, and how the model is so important. Like one of the second years um, ended up introducing it in his job setting. Brian did, because they wanted them to work more hours but didn't want to pay them more or hire more athletic trainers. So he presented this tangible uh, value model showing, hey, this is what we do. This is why you need us. This is why we are worth the amount of money that we're asking for or another person.
I agree with all of you. I think a value model is important. But I was going to say, isn't there something to, I guess, proving your value with your clinical skills? Because I feel like that's an argument that could be made that, while a value model is important, really each individual skills are going to be different. So you should kind of get paid based on, or value based on your individual skills as well.
I mean, I agree with that. I think, like Laj was just saying before that, is that you can create your own individual value model and represent who you are as a clinician into the value model. Because I think just because you are really good at a clinical skill doesn't mean that anyone, that your overseer or your employer knows that you are. I mean, you just have to put that into, like, put it down on a piece of paper for them to understand exactly like who you are and what your worth is.
Megan, I was definitely thinking that. Like, definitely thinking, like, how, like, because I mean, my employer is in my athletic training clinic with me, but like a few years ago, I worked at a high school and I was the only one there by myself. I mean, the AD would pop in and out, but they don't know what I'm doing. They don't know like Graston. They don't know like I'm cupping and doing these manual therapy techniques. And like I brought it down on a piece of paper, but essentially those kind of things mean nothing to them depending on the type of stakeholder that you're presenting the value model to. So I think you also have to do it like individualistic, like to you specifically, but then also make it to where your stakeholder can follow as well without being an advanced clinician or without being an athletic trainer in general, because a lot of people are going to be presenting these value models to people who are not athletic trainers, so will not know what you're even talking about.
What would be the most important part of a value model?
I feel like part of it making like playing an actual role in what you're trying to like get out of making a value model is making sure that your audience can understand it. Like if I put out a volume value model and like Laj was saying, like my AD has no idea what I'm talking about. Like if I explain it in a way that's not like reader friendly, then there's people are gonna be like, okay, here's some numbers and she made some money. Okay. Like if I sit there and I narrate it well and I'm able to sell what I've done, then people are gonna be like, okay, I understand like actually what she does on a day to day. That makes sense. Like hopefully by the time you do one of these, people know that already. But like if you're not able to put this in a way that they're gonna care about it or like see what effort you put into it, then it's not gonna matter.
Yeah, I agree. And I think also like putting in the amount of detail that you need to. So, like, yes, you're applying therapeutic interventions to so and so, and that's kind of easy for us to track because, you know, we're doing it, we see us doing that. But I think also putting in like everything that we do. So, traveling with teams, setting up the waters, like, not forgetting all the little things that seem to us like a daily routine, but most people don't know that we do that. So I think adding in all the details to a value model is important to show like our exact worth. So.
And I kind of agree with you, Megan, where I think it's even worthwhile to go even more in depth into using your example of therapeutic interventions, going maybe into the different types of intervention you use, because there are going to be different um, billing codes for them for each different modality, and that could really give us a more accurate representation of our value. So then, what are the best ways to measure value? Or just some good ways, maybe not the best.
I feel like being able, like, I know we talk about this all the time, and we talked about it over NATA with some of the other students from different DATs, but you know, like, we are so used to doing outcomes now. We implement all these pros and crows, and we're collecting all this data after, and we are able to see all these numbers. And then even if the number is bad, so if obviously like an AD or a hospital administrator will be able to see your outcome data from these tools, but if they're negative, then they're going to think, well, this person doesn't know what they're doing, or what they're doing isn't actually working, or we don't need to put money into funding her going to this workshop, when a negative response could lead to something too. So if you're able to narrate what you got a negative outcome from, or if your scores from one modality weren't as positive as another with a specific injury, if you're able to narrate that and, you know, kind of qualify that in some way other than just a score, I feel like that kind of qualitative data has just as much value as a quantitative data.
I think for us, like measuring value, one of the best ways could be, and I'm just thinking about how someone like a boss would think, is to show them your productivity. And so I think sometimes people say, oh, I worked this amount of hours, but you don't show how you've been productive these amount of hours. So maybe you can have written down, okay, especially like at a high school setting, I think it's pretty easy to show productivity there because kids get out at 3 o'clock, and then you can have a sign-in sheet, and probably 50 or 60 people have signed in from 3 o'clock until 4:30 when they're trying to for practice, for their practices or for games or whatnot. And then you can see on there everything that you've done with them, and maybe have them even write down like, okay, ankle taping, ice stem, whatever the case is, the treatment that they've done. So then showing how productive you are, and then showing, okay, from so at 4:30 I went out and I made waters for football, and I did 10 gallons or whatever the case is, and then I was at football practice from this time to this time, chugging around, doing, whatever you're doing. And so I think showing that over a length of time, how productive you are during the day, to me can be a really large predictor of your value. And, that kind of thing, because no stakeholder, anybody wants to see that, oh, okay, well, I know that you've been working 60 hours this week, but like, what exactly have you been doing?
Yeah, I agree with that, and I think that's a good way to measure it. And a guy that was my preceptor in undergrad, he like created his own Word document, and it was literally like as simple as a chart that has like name, like what are you in for and what time, and he like glued the top together and it made like a little notepad, and it was the simplest, but like every day when someone would walk in the door, he said, please sign the sheet first and then I'll get to you. And like it took maybe 5 minutes out of his day to like make that and put it up there, and it saved so much time in the long run, because when we were even logging information, we would go back and look at that sheet. So I think that's a great idea. And I think just I mean, basically we all know this, but like how you can also measure your worth is the CPT codes that you mentioned before, Brian. Like there are averages for athletic training that we can like go back and look at, just so we can help put that into our value model. When me and Laj were on the Dr. Patton's synchronous session the other day, he said like, oh, something about literally one of the average values of an athletic trainer, like if you break it down for what they're worth per hour, like some people are getting paid $11 per hour, and like you can make that at like a night shift at like at McDonald's. And like that's what this whole conversation should result around, is like, how do we get to this point where we're making the same amount as people that don't have any degree working at a fast food restaurant? So I thought that was crazy, and I didn't realize once it was broken down to how bad it was. So.
Yeah, I think that's interesting, and I was going to mention that as well, Megan, is like Lodge, just to challenge you a little bit, was saying how we can measure patient interactions and how many patients we see, but does that actually give us an idea of maybe quality improvement? Are we doing a good job? Are our patients getting better? I think that is almost, because we can see 1 million patients, but if we're not improving their outcomes, then is it even worthwhile for us to be there almost? So just to challenge you a little bit, Lodge, I thought that was just something I would add.
No, I definitely agree. There's actually a like not clinician, but a patient perceived outcome measure about their treatment with athletic training that I talked about with another group that I came across randomly maybe last year, that Marge Album wrote. She was a former NATA president, but like she came up with in literature. And I think like you're right, that was a really good, like, hey, I'm treating on these patients, because like you said, there could be some athletic trainers who are doing treatments and then the patients don't see it, no matter even if they're treating 100 people. That is just not good patient care.
Yeah, so then let's get into this a little bit, where obviously they're important, but is there different information that we would need to put on these value models to target for different target audiences, like stakeholders, other healthcare providers, or even just kind of to support athletic trainers?
Yeah, I think it would depend on your goal for that specific value model. Like you were saying, if you're trying to target stakeholders, like in my case, if I'm trying to target my investors at the hospital and I need to show them, my like qualitative side of my rehab notes, and I put, I kind of trend those and I put them into a data set, and I show them like, hey, this is a trend that I, consistently don't have enough of this, or I'm constantly using this one tool and I'm having to wait on other on other patients to finish up using it, then, maybe I can get funding to buy another one of those tools, whatever it may be, or make a more easy to use EMR. I feel like it all depends on what your end goal is, like exactly what you were saying, is what type of data are you going to present?
I agree. And like, when I think of, because just like for your assigned setting, I'm in the middle of finding a job right now. But the one job that I was looking at, I would have been a first athletic trainer at the high school ever. And so when I think of this value model, I think of just like sticking with more of the basics. Because like Kristen, you're like already at your job, like you've been there. So you want more tools or more modalities, let's say, because you're saying you're using one all the time. But for me, I would focus just straight up on like the patient care I'm giving, what I'm doing, how many patients I'm seeing, because they've never even seen that at all in their setting at all. So I want to prove why I'm needed there and why they should keep me around, because it's like a part-time job right now, 30 hours a week for that school. So I think it'll be good for me to like show how much athletic trainers are actually needed.
I don't know if there's an answer, or I don't necessarily have answer to this question, but is there anything that we would really need to prove our worth to other healthcare providers?
I'm trying to think. So when y'all were talking about all of like the sign-in sheets and stuff and doing things like that, I remember getting into not really even an argument, but something, I don't even know what you would call it, with my hospital staff, letting them know like they wanted me to, literally write down at this time I didn't have any patients, at this time I was eating lunch, at this time I was doing this. And I just thought that it was like offensive to myself that, they're not going to ask a orthopedic surgeon to do the same thing. They're just going to check their post-op notes or their pre-op notes or the scrub nurse's timeline. So I feel like either doing better at just general daily documentation, so not waiting until the end of the week to enter all of your written notes in, but really just being consistent with your documentation throughout the day can make a really big difference at other healthcare professionals seeing you the same because they're doing the same thing daily. And then also either speaking, like not speaking, I guess writing in a way that other healthcare professionals would write. So again, knowing your target audience, if I know that my supervising ortho physician is going to be reading it, I may pay a little bit more attention to my my rhetoric than I would if I was presenting this to the board. Then my language would be a lot different.
I agree with everything you just said, Kristen. I think, yeah, I just agree with what you said. I could go on a tangent, but I'm not going to.
So then I'll change the direction of the conversation a little bit. Something that maybe we're all a little bit passionate about because we're involved is how do we kind of go about valuing the DAT?
Oh yeah, we talked about this yesterday and I was like, oh my gosh, we can value ourselves so much. We know so much information. Like just, I think last week when we were reading the articles in Dr. Games's class, when it was talking about the nurse practitioners and the difference between their clinical doctorate and their, the PhD. And like the fact that we are the bridge that lies between researchers and clinical practice, like people that are practicing in the clinic, we're those people that are educated enough to synthesize the articles, even create our own research to implement, see how like translational research to implement into clinic. Like what needs to be happening. And also I think Elijah can talk about a couple topics that we talked about, but we were also talking about like especially with Indiana State DAT, because there's all different doctorate programs have different, standards and values. And since we're accredited and kind of, we also lean towards leadership and advocacy, like us valuing, like showing how, like us being leaders wherever we are and showing our like value, that can just help, help us prove that. So, Laj.
No, I agree. That, and like Megan said, some of the stuff we were talking about in our synchronous session, but like basically showing, like as far as like education goes and how the DAT, like we can be leaders within our profession, and then showing basically really engage in like transitional like research. So basically like applying, being able to synthesize the literature and then applying that into our clinical practice. And so I think that's what's bigger in the DAT than with terminal degrees or with master's degrees or bachelor's degrees, is that research synthesis focus and then actually applying it to our clinical practice. And so like Megan was saying, that's what's different with ISU DATs as well, is because we do have that clinical practice component. And so I think that's really, really huge, especially if we're getting a clinical doctorate.
I feel like a big part of it is, so over NATA, we had that, I don't remember if we all got the email or what was it, but DAT students past and present were asked to all kind of come to this peer-to-peer discussion, and the professors and just other people interested in the DAT and just wanted to talk about continuing ed. And athletic training, we're all asked to come to this peer-to-peer. And it was so interesting how everybody's dynamic kind of changed once we understood, like somebody mentioned, like we're all being kind of aggressive and really territorial over our degrees in our schools and where we're at, which of course, like we're all going to want to represent where we came from and believe that, well, our program is the only one and the best one. But at the same time, like we need to be able to graduate and leave from here and maybe collaborate from DAT students from other places that maybe weren't post-professional or weren't clinical based, and realize, like what their degree was just as significant, but that their clinical, or not their clinical skills, but just their skills as a student and a researcher and an educator can be just as significant as what we were doing. And how they're going to value that is going to be completely different from how we value it, but it's still going to be significant. Does that make sense? I feel like I just went on a tangent.
No, that makes sense. But like our whole conversation, not our whole conversation, but a good 10 minutes of our conversation yesterday was like us not being supportive of like the other DAT programs. We're like, oh my gosh, they take 6 credit hours and they're going to get the same title as us. Like, what the heck? But I also agree that, yeah, that is how it is right now. And there should be an accreditation where that's not happening. Like we are all putting in the same effort, but it's not right now. And so we need to kind of like step up and be aware that we are going to have to collaborate with these other people who are, maybe not have a clinical or not so based on a clinical, but based maybe on research. And so like for us to make way in athletic training, we're going to all have to kind of collaborate together.
And I think it's interesting how, yes, we're all different, but I think, like Megan said, with time, things will kind of change, and maybe just like undergrad programs at different schools, some are stronger in different areas. I'm living on the University of Pennsylvania right now, and they have, Wharton School of Business is probably one of the best business schools around. So I think as we kind of have these different programs, some are going to kind of stand out and some are maybe going to fall to the wayside, but hopefully together the different programs can almost hold each other accountable and make the DAT worth more than it was, the previous year. So.
Agreed.
So we can go from here and ask, what are you guys going to measure from this point forward, and how are you guys going to work on increasing your own value or creating a value model for yourselves?
I kind of hinted on that a little bit earlier, but like I said, I'm at the new place. So if I'm the first athletic trainer there, I am going to just start measuring, all of the patients I encounter, the treatments that are given, the games and the practices that I go to. I'm just going to try to work on those basics because I don't want to try to get too far out and then not have any good value of where I'm at. So that's where my main focus will be.
I think my main focus is going to be my continuing ed and like constant integration of my competence through my education and my clinical practice, and kind of like validating that what I'm doing with my school and keeping up with my CEUs and doing all these things on the education side of stuff is impacting my clinical practice. I just feel like some of my stakeholders, I don't know if I should, whatever, don't really see it like that. They more or less want to see a test score, and that's not something that we should have to do. So I feel like maybe making a value model based on my integration of things that I'm learning or how my clinical practices change within the year would kind of show them that without having to take a written test.
Yeah, I really like the idea that I think it was Megan you said about documenting your patients and just how many patients you see on a daily basis, especially in a high school setting, is extremely necessary. Right now, I am working with a professional soccer team in Philly, and I kind of got thrown in while they are doing some work and trying to find a new athletic trainer because they're all on left. But essentially, I'm doing the job of um, athletic training, strength coach, and just kind of a whole performance department. And so I think that kind of measuring what I do in terms of what I can't do in terms of like strength and conditioning and maybe more of a nutrition aspect could be useful to help get more uh, staff involved to get the best possible outcomes and results for the team and for the patient. So for me, it's not really for self-advocacy, but more for distribution of tasks. And what I would measure is probably just the things that I currently do that are more related to other disciplines, or what I should be doing, or what I can't do because I have to do 6 different things.
What a fun summer.
Yeah.
I think that's good though, Brian, because like I think there's a history in athletic training of having the athletic trainer do all of these like random things that it's like really not in our job description. It just makes us overwhelmed with things. Uh, an athletic trainer who worked professional hockey, and he was and this was a while ago, so I don't even know if they do this anymore, but not only was he an athletic trainer, but he was involved like with getting their travel arrangements together. Like, isn't that the job of like an assistant coach, or like an intern or something like that? Like,
Coordinator.
yeah, like, so I mean, those are the type of things like you said, like writing all these things down, like, hey, these are all the things that I do. I can't be effective in my patient care if I'm doing these other things, or just like you're like showing your value, like you said, like you need to hire either someone else, you know.
Sure. Um, those are all the questions that Dr. Cowden put out, and plus some. Does anyone have anything else they want to add? Any other questions they have?
No, I
I
don't
don't
think
have
so.
anything.
All right. Well, I guess that's it for today. Thanks, everybody.